Bismillahirrahmanirrahim. Today we are going to discuss the structure anatomy of scapula. This is the scapula, which is also called shoulder blade. It is a triangular bone. It has 3 angles and 3 surfaces. So let's start the naming of the 3 angles first. The above angle is called superior angle. As we know, superior is the term used for above, and similarly below the angle which is at the bottom, it is called inferior angle, and this is the lateral angle. Superior, inferior, and lateral angle. This is the medial side. This is the right shoulder. If you assume the person, here is the person head, here is his neck, this is his rib cage, this is his chest, and this is his right shoulder blade or scapula, and here would be attached the humerus bone. So this is the medial side because it is toward the center of the body, the medial line of the body, and this is away from the body, it is the lateral. So it is lateral angle. Medially are 2 angles, so we call it superior and inferior. Similarly the sides, so this side is called medial side because it is toward the midline of the body. This is called lateral side because it is away from the midline of the body. Above one is called superior side because it is above. So these are the 3 angles and 3 sides. Now there are 2 surfaces. The one is this surface which is to the front, and the one is back side. If we rotate the bone, there would be another surface which is the back side. Here it is shown. This is the front side. It is also called anterior side, anterior surface, and also called costal surface because it faces the ribs. Costal surface, anterior surface, front surface, back surface, or posterior surface. On the front surface there is a shallow depression. This is a shallow depression which is called fossa. Fossa is the term used for shallow depression. So this is the subscapular fossa. Subscapular fossa is scapula, subscapular, inside the scapular. Subscapular fossa, to the front of the scapula, on the front side of the scapula. And on the back side, the posterior side, there are two foci. One is this one, and one is the smaller one is above this one. And between these two foci, here is a bony projection which is going this way, and here it is terminated. This bony projection is called spine of scapula. This is called spine of scapula, and it is terminated over here. This point is called this, which is extended or expanded portion of this spine. This is called acromion. Acromion process. Process means projection. This is the acromion process. This is the spine. The spine end to form acromion process, and this is on the back side of the scapula. So now this is the it is called because it is above the spine and it is a fossa, so it is called supraspinous fossa, and below is the infraspinous fossa. Supraspinous fossa and infraspinous fossa, these are the sites for muscle attachment, and the muscles are named according to their attachment sites. So this is the supraspinatus muscle, infraspinatus muscle, and this is the subscapular fossa. So the muscles is called subscapularis. Further, there are two projections which are called processes. The one is toward the front side. This is one, the smaller one is toward the front side, and you can see behind it is the big one, the bigger one. We already mentioned it here. This is called acromion process. Acromion process is toward the posterior, a little posterior to the coracoid process. This one, the smaller one, which is to the posterior aspect. On the posterior aspect, this is called coracoid process, and that is the acromion process. And below, on the back side, there would be a spine which is running here. And this is acromion process, coracoid process. Coracoid mean just like the beak of a crow. So this is just like a beak of a crow, coracoid process. Now there is the attachment site of humerus, which is the arm bone, which is attached here. This is the attachment site for humerus. There is depression, a type of circuit. There is a bilateral circuit joint between the humerus and the scapula. So this is the circuit for humerus, the head of humerus. But this is not very deep circuit, just like we see in the other bones, bilateral circuit joints. This is a relatively shallow circuit. So this is also called glenoid fossa, glenoid cavity or glenoid fossa. Fossa because it is not that cavity, that type of cavity, not very deep but a shallow cavity, so it is also termed as fossa, glenoid fossa. There are two tubercles. One is below smaller outgrowth is called tubercle, this one, and one is above, just above there, above the glenoid cavity, and one is below glenoid cavity. So these are termed as which one is above the glenoid cavity, it is called supraglenoid tubercle. Supra mean above, and below is called infraglenoid tubercle and supraglenoid tubercle. So these are two tubercles. Tubercles mean a small outgrowth on a bone is called tubercle. Infraglenoid tubercle, supraglenoid tubercle, and the center between these two is the glenoid cavity. So these were the main structural points which we should know about the scapula. Further, if we talk about the muscles, which muscles are attached here, so we already mentioned three muscles. The above and the back side, posterior side, above the spine is supraspinatus, below spine is infraspinatus, and on the front side toward the ribs, this costal surface, there is subscapularis muscles. Further, there are three muscles which are attached to the coracoid process. The small process, there are there are three muscles attached. The one is long head of biceps brachii. We know biceps. The biceps, long head of biceps. Biceps mean two. There are two heads of biceps, and triceps, they have three heads. So long head of biceps is attached to this coronary process. Further, second muscle which is attached here is the pectoralis minor, pectoralis minor, and biceps brachii, and the third muscles which is attached here is the deltoid muscle. Deltoid muscle is also attached here to a clavicle, and also to the acromion. Now, there is deltoid muscle attached to the acromion process, and also there is and the acromion, there is articular surface for the clavicle bone, which is running in this way. It also attached, the clavicle also attached here. So this is articular surface for clavicle, and the joint which is formed here is called acromioclavicular joint. There are, oh sorry, I mentioned the short head of Mystacuricae, which is attached here. The long head is attached to the supraglenoid tubercle. The short head is attached to the coracoid process. The coracoid process is not, you can, what you see in the diagram, it is not above the tubercle. Rather, it is to the front. It is here in the front of, to the posterior aspect of the scapula. Long head arm biceps attached to the supraglenoid tubercle, and to the infraglenoid tubercle the long head of triceps brachii is attached. Further, there is on the medial side there are attached first here to the back side of to the back side and a little below the superior angle, little below the superior angle on the middle side of the scapula, and its back back side, which we called the posterior side. Here you can see in this diagram there is attached levator scapulae muscle, which help and which is go above here toward the head on the back side, and it help and rotating and pulling upward the scapula. And medial border and on the anterior aspect on the front side there is attached first muscle is one is the teres major and teres minor, and rhomboid major and rhomboid minor, and the medial side are rhomboid minor. First rhomboid minor is at the level of spine, and the here rhomboid minor, and in this diagram here, and to the medial border here on the medial border is attached rhomboid minor, below is rhomboid major, and here on the lateral border is teres minor above and teres major below. The minor are above rhomboid minor, teres minor. Rhomboid minor is above here, teres and rhomboid major is below. Teres minor is above, teres major is below. And latissimus dorsi, it is attached on the inferior angle. Here you can see latissimus dorsi. So these are the muscles which are attached to the scapula. I hope the video was helpful, and stay tuned for further anatomy videos. Thank you so much. Allah Hafiz. We talk about the muscles which are attached on the scapula. So first of all, as we discussed, there are above the spine, the muscle which is above the spine is called supraspinatus, and which is below, and this is called infraspinatus. The supraspinatus is attached to the supraspinous fossa, and infraspinatus is attached to the infraspinous fossa. Here to the subscapular fossa, the muscle attached is called subscapularis. Subscapularis, supraspinatus, infraspinatus. These two are on the back side, the posterior side, and the subscapularis is on the costal or surface, front surface or anterior side. On the border or sides, there are muscle attached So there are two motors. One is medial motor and the one is lateral motor. On the medial motor are three muscles attached. The one is above, just below the superior angle. On the medial side, there is attached levator scapulae muscle. Levator scapulae muscle goes upward toward the head and it pulls the scapula above toward the head. Below the levator scapulae is rhomboid minor. Rhomboid minor is at the level of spine, where spine starts. There is rhomboid minor on the middle border. This is the middle border in this diagram. This is the middle border. Rhomboid minor, and below rhomboid minor is rhomboid major. So levator scapulae, rhomboid minor, rhomboid major, and here just closer to the inferior angle is the fourth muscle, which is the latissimus dorsi. Latissimus dorsi. On the lateral border, there are two muscles attached. The one above here is called teres minor, and one below is teres major. The minors is in the rhomboid minor. The minor is above, and the majors are below. Rhomboid minor, rhomboid major, teres minor, teres major. Rhomboid are on the middle border, and teres minor and teres major are on the lateral border. To the coracoid process, three muscles are attached. The first one is the short head of biceps brachii. We know biceps. Biceps mean it has two heads. So the first head is one is long head and one is short head. The short head is attached to the coracoid process. Another muscle which is attached here is the coracobrachialis. It is also the arm muscle, which is going from the arm at another head. It is the origin of the muscle, and its insertion is on the humerus. So the muscles goes to the humerus. Also the biceps goes toward the humerus. So the short head of biceps brachii, coracobrachialis, and the name you can know from the name coracobrachialis. So coraco means its one head is attached to coracoid process. And the third muscle which is attached here is the pectoralis minor. Pectoralis minor is on the front surface, on the front side of the ribs, and it goes toward here. And we would further, and in the upcoming videos we will discuss the muscles in detail. So the function of pectoralis minor is it pulls the scapula toward the front or toward this lateral side. So these are the three muscles which are attached to the coracoid process: short head of biceps brachii, coracobrachialis, and pectoralis minor. The muscle which is attached to the acromion process is the deltoid muscle. Deltoid muscle, which is the main shoulder muscle, just at the level of shoulder joint. The muscle which you feel above is deltoid muscle, and on the posterior side, on the superior side of the spine, there is attached trapezius muscle. Further, here at the acromion process, there is also articulation surface for the clavicle. We know here is the clavicle bone, which is also called beauty bone. It is just below the neck. Its one end is attached to the sternum, and the other end of the clavicle is attached to the acromion. Here is the attachment surface for acromion. This joint which form here is called acromioclavicular joint because it is between the acromion process of the scapula and the clavicle. So this is the acromioclavicular articulation surface. there are two muscles which are attached. One is above the glenoid cavity or glenoid fossa and one is below. We discussed there is multivercal just above the glenoid cavity, and this is called supraglenoid tubercle, and below, just below the glenoid fossa, there is infraglenoid tubercle. The muscle attached to the supraglenoid tubercle is long head of biceps brachii. You shouldn't confuse with the long head and short head. Here you see that the coracobrachialis, the coracoid fascis is above the glenoid fossa, but isn't the case. The coracoid fascis is not above, rather it is here to the front of the glenoid fossa. It is to the front. The humeral is toward the back side, and in between these two processes there is the glenoid cavity or glenoid fossa. So the long head of biceps brachii is attached to the supraglenoid tubercle, and the short head is attached to the coracobrachialis. The coracoid process, and below the glenoid fossa to the infraglenoid tubercle, the muscle attached is the long head of triceps brachii. We know from triceps it has three heads. So the long head, the median head, and the lateral head. These are the three heads of triceps brachii. So here is attached the long head of triceps brachii. The other two heads are not attached to the scapula. They are attached to the humerus. So only long head of triceps brachii is attached to the scapula, which is attached to the infraglenoid tubercle. So these were all the muscles which are attached to the scapula. If we revise, so this first of all, levator scapulae, rhomboid minor, rhomboid major, and latissimus dorsi, and the medial border and the lateral border, teres minor and teres major, and the infraglenoid tubercle, long head of biceps brachii, and supraglenoid tubercle, long head of biceps brachii, below is the long head of triceps brachii, and on the coracoid process, the short head of biceps brachii, coracobrachialis, and pectoralis minor. On the acromion there is deltoid, and on the front surface, anterior surface, there is subscapularis. On the posterior or the back side, there are infraspinatus and supraspinatus, and on the spine there is trapezius. So that was all about the scapula. Hope the video was helpful. Stay tuned for further videos. Thank you. Allah Hafiz.